Alex Rowley.
Thank you, Presiding Officer. To ask the Scottish Government what action it is taking to ensure that anyone who may need help with a mental health problem can access appropriate help easily and receive treatment quickly.
Minister Michael Matheson.
We have made significant progress in delivering the commitments in the National Mental Health Strategy 2012-2015. For example, Scotland was the first part of the UK to introduce a target from December this year for speed of access to mental health services. We know that waits of up to 1 and 2 years were common before we introduced this target. We still have further improvements to make, but the latest position shows that the average wait for access to psychological therapies is 8 weeks, and access to specialist child and adolescent mental health services is 9 weeks. And I am sure the member would recognise that is significant progress.
Alex Rowley.
I thank the Minister for his response. However, given that the Scottish Association of Mental Health recently reported that in Scotland 25% of people who experience a mental health problem will wait more than a year before they actually seek help, and that additionally an estimated 800,000 adults a year won't know where to access help, would the Minister agree with me that having trained mental health first aiders in all of our communities would help to quickly identify those who need assistance and direct them to support services? And what is the Scottish Government doing to promote the Mental Health First Aiders programme and increase the number of trained mental health first aiders in Scotland?
Minister.
I think the member makes a very good point. I think it is widely recognised that there are many individuals who may have a mental health problem and they can leave it an extended period of time before they seek assistance from clinicians. And a key part of the strategy we have taken forward in order to encourage people to access help is through the anti-stigma campaign, the See Me campaign, in order to remove the stigma that is often associated with mental health, which can often act as a barrier to individuals seeking help in the first place. Can I also say that the issue of the Mental Health First Aiders programme is a very valuable one and has got an important part to play. And one of the areas of work that we are going to take forward as part of the mental health strategy is to look at how we can continue to improve access to mental health services, including aspects such as the Mental Health First Aiders programme. And I would be more than happy to discuss that matter in further depth with the member if he would find that helpful.
Dennis Robertson.